Coming on to the art of switching antipsychotics. Patient can develop agitation, activation, insomnia, rebound psychosis, and withdrawal effects, especially anticholinergic rebound, if done too quickly or without finesse. Best results are usually obtained by cross-titration over several days or weeks. This is not only acceptable but in fact desirable polypharmacy. If the second agent is not satisfactory, it is generally preferable to try a third rather than to use two agents together indefinitely in what can be unacceptable polypharmacy. Switching between two agents that are similar is generally easier, faster, and has fewer complications, namely peen to a peen or done to a done in as little as a week's time. The binding characteristics, as we have studied, of peens and dones are different. Peens in general have more anticholinergic and antihistaminic actions, thus are more sedating than the dones. When switching from peen to a done, it is generally a good idea to stop the peen slowly over at least 2 weeks, allowing the patient to readapt to withdrawal of blocking of cholinergic, histaminic and alpha receptors, and thus making the transition more tolerable without anticholinergic rebound, agitation or insomnia. Clozapine should always be stopped very slowly, over 4 weeks or more if possible. And from a done to a peen, it is generally best to titrate up the peen over 2 weeks or more to become tolerant to the sedating effects of most peens, although the done can usually be stopped as quickly as over 1 week. Switching to and from aripiprazole is a special case, in part because it has different pharmacological properties. It has higher potency for D2 receptors than any other drug, meaning that its administration causes essentially immediate withdrawal of the first drug from D2 receptors. And these principles are also applicable to the new forementioned PIP and ARIP, namely brexpiprazole and cariprazine.